So when people, when I tell them I'm an interventional cardiologist, the question is, what is that? And what you see here is a heart catheterization laboratory with me positioned here and the camera and the patient. And we deal with the blood supply to the heart predominantly, but I also deal with the blood supply in every other part of the body, the carotids to the brain, the aorta, the kidney arteries, the peripheral arteries to the legs. What you see here is a right coronary artery that's closed in somebody that's having a heart attack, and we, through a catheter, put a wire through here, do a balloon stent procedure to reestablish the blood supply in the setting of a heart attack, and I do this every day, predominantly at Memorial Hospital. This is an image of an artery and a stent being deployed, and the stent keeps the plaque open. I'm an interventional cardiologist. Let's hope you don't need me. I am on staff at several other hospitals, though: Baptist Center downtown, Baptist South, St. Vincent South, Orange Park Memorial, and then Flagler Hospital. So my group covers a lot of territory, and we're certainly here to meet the cardiovascular needs of the community. This is a real case from November 14th, and my day started with a 38-year-old woman waking up at home with chest pain that was unrelenting. 38 years old. Remember this. She has a history of untreated high blood pressure. She's a smoker and a mother of 5. Untreated in the sense that when I saw her when she arrived, I said, do you have high blood pressure? She said, yeah, but I haven't been taking my medicines for 5 years. She goes to the Memorial Hospital emergency room at Kernan and Atlantic, and an EKG is done suggesting an acute myocardial infarction or a heart attack. And in the modern era, that's digitally transmitted to my handheld cell phone. And I look at it, and it looks like a heart attack. And I call them back, and I say, I'll meet you at the cath lab at Memorial Hospital. So I get it. I'm what's called the STEMI doc. And the STEMI doc is the ST elevation myocardial infarction doc. That means the heart attack doctor that day. And so emergent medical stabilization happens at the freestanding ED, but she comes to the heart catheterization laboratory. This is the image of her heart catheterization. This is what's called the right coronary artery to the bottom part of the heart. You have the spine here, the head's up here, the chest is here, the feet are down here. This artery supplies blood to what's sitting in the middle, which is the pumping heart. This is her left coronary system, left main, circumflex, LAD. But what you don't see here is a vessel right here. And this is the biggest of the 3, called the left anterior descending, and it's the missing mid-LAD. You don't see it. So we, through a guide wire, put a guide wire down the vessel, we balloon it, and we put some stents to open it up. So here's before. You don't see this vessel. Terminates here. This is after. Reestablishing the blood supply. And so what we do is we get a better blood supply to this part of the heart so it doesn't die. And this is all done emergently. Patients are, by the time they get to the hospital, we try to get the artery open on a national recommended before 90 minutes. We're typically below 60 minutes at Memorial. We're very good at this. And this reestablishes the blood supply, takes away the chest pain, saves heart muscle. And the faster we can do this, the better heart function she has, because the longer it takes, this heart muscle is going to die. So, what went wrong here? Well, it's pretty clear she failed to understand her own risk for this type of an event. She failed to address the risk factors that could reduce her risk: high blood pressure management, and she was a smoker. But what went right? What went right was she recognized the symptoms, she called 911, she received modern health care. But what happens next? It's medical care, follow-up, risk factor modification, because if she's already had one heart attack, she's at risk for another one. We want her to help raise those 5 kids and be thankful every day, because sudden death is often the first symptom of a heart attack. People always ask me, how many heart attacks happen every year in your community? And it's statistics were done at one time on this. Only about 25% of people with a heart attack show up at an emergency healthcare situation. That's because 50% die suddenly. Done. 25% stay at home think they had an ulcer, live through it, seek their health care when they have a problem related to that soon after that, probably go to their primary care doctor as opposed to an emergency situation. But only 25% call 911 and get to us. So there's a big opportunity if people can understand the symptoms, but also understand your own risk for this. Because if you say, I'm a low-risk patient, it's hard to lower my risk. But if I'm a high-risk patient, I got some risk to lower, right?